Welcome to my channel. Bleeding or spotting during pregnancy is a common problem. Approximately 25% of pregnant women experience bleeding or spotting during their pregnancy. In other words, 1 out of 4 pregnant women experience bleeding during pregnancy. Many sisters have commented to me that they conceived and were pregnant for 1 month, 2 months, 3 months, even 5 months, but suddenly their menstruation starts again. Can it cause danger? What should I do now? First of all, let me clarify that if there is bleeding during pregnancy, it is not menstrual bleeding. You need to understand that bleeding during pregnancy is a sign of danger. So the question is, what are those dangers? In this video, I will discuss about number 1. What are the causes of bleeding during pregnancy? Number 2. What symptoms accompany bleeding during pregnancy that indicate danger? Number 3. What should be done if there is bleeding during pregnancy? So let's get started. The highest chance of bleeding or spotting during pregnancy occur in the first 3 months of conception. Many people mistakenly think that they have started their menstrual period when they see bleeding during pregnancy, but that is not the case. Menstruation does not occur during pregnancy because when pregnancy occurs, the HCG means human chorionic gonadotropin hormone typically increases in woman's body. For this hormone, urine tests show a positive result and woman's menstrual period stops. Another common mistake is that many people think if there is minimal bleeding or spotting after pregnancy is confirmed, it is implantation bleeding. However, that is not entirely accurate. You see that implantation refers to the process of the fertilized egg attaching to the endometrium, which is the lining of the uterus. After fertilization occurs between sperm and eggs, when the fertilized egg attaches to the uterus, it is primarily referred to as implantation. During this process, some people may experience minimal bleeding or spotting, which is known as implantation bleeding. Now, the question is, when does implantation bleeding occur? It mainly happens before a misperiod or around the time of the period. If someone experiences 1 to 2 drops of blood around the time before misperiod or close to the period date, we suggest think a urine test after 8 to 10 days. This is because after implantation, the urine test may show a positive result. However, if someone experiences bleeding after positive urine test, then it is not implantation bleeding. I hope you understand these topics. Now let's move on our main video. What are the causes of bleeding during pregnancy? The primary causes of bleeding during pregnancy is miscarriage. If there is slight bleeding after a positive urine test, it could be sign of threatened abortion, which means the early sign of miscarriage according to medical terminology. It may indicate a threat, but it does not necessarily mean a miscarriage has occurred. In this situation, if you follow the advice of a doctor, they may prescribe hormonal tablet or injection to prevent miscarriage, and you will be saved from miscarriage by the grace of Almighty Allah. If such a situation occurs where there is a heavy bleeding, somewhat similar to a period or even more, and occasionally blood clot, or a small piece of tissue come out along with abdominal pain, then it indicates miscarriage. During this time, it is necessary to consult a gynecologist and have an ultrasound done to confirm whether a complete miscarriage has occurred or not. If a complete miscarriage has not occurred, there is a possibility of retained product of conception causing an increased bleeding and increasing the risk of infection. In this case, the doctor may prescribe medication or perform a DNC, means dilatation and curettage procedure, to remove the retaining fetal tissue. Some people experience light brown colored spotting or less bleeding during pregnancy. In this case, there is nothing to fear about this. However, in some cases, it can be cause for concern. The color of blood turning brown indicates that the amount of bleeding is less. That's why the color of blood has changed. It can be seen in case of molar pregnancy or missed abortion whether the normal progress of pregnancy does not occur. To determine such condition, an ultrasound should be performed. It is difficult to make diagnosis just for visual or clinical observation. In the case of an ectopic pregnancy, there can also be a severe abdominal pain along with vaginal bleeding. When the fertilized egg implant and grow outside of the uterus, usually in the fallopian tube or ovary, it is called an ectopic pregnancy. This is a life-threatening condition that can lead to mother's death. Even in this case, a urine pregnancy test may show a positive result, but an ultrasound is necessary to confirm such condition. In the first 3 months of pregnancy, these problems are main cause of bleeding during pregnancy. If a miscarriage occurs during the 4th to 6th month of pregnancy, it may be due to complication related to the mother's cervix, such as cervical insufficiency, cervical dilatation, or sign of preterm labor. This time, miscarriage can occur, which is not good sign. The placenta is attached to the upper part of the inner side of mother womb. Please concentrate that image. Normally, the placenta is delivered after childbirth. However, if for any reason the placenta covers the upper part of the cervix, is called placenta previa, and in this condition the mother may experience bleeding without pain, that indicating the start of a miscarriage. Conversely, if for any reason the placenta separates partially or completely from the uterus, it is called an abruptio placenta. In case of placenta previa or abruptio placenta, they may excessive bleeding from the mother, which can life-threatening. Therefore, if there is any bleeding during the 4 to 6 months of pregnancy, please consult with a gynecologist immediately. If there is bleeding or spotting during pregnancy, whether it's occur in the first month, second month, third month, 8, even 9 months, it can be cause for concern. Normally, childbirth occurs between the 38 to 42 weeks of pregnancy, and there may some bleeding during childbirth. However, if a pregnant woman experiences bleeding between the 28 to 37 weeks of pregnancy, it is often due to complication related to the placenta in 70% of cases. So, if the bleeding during pregnancy is small, even 1 to 2 drops or brown in color, please do not delay to consult with a gynecologist. An ultrasound can determine if miscarriage has occurred and if there is any complications. Remember, menstruation does not occur during pregnancy. If there is a bleeding during this time, it means there may be some issues with your unborn baby. Therefore, it is essential to consult a gynecologist without delay. No more today. Hope today's video was helpful for you. If you find the video helpful, don't forget to share with your friends. Please subscribe to my channel to get health related advice, health awareness and reproductive health related all the video. And remember to become a member of our family. Stay with us healthy and safely. Thank you for watching.